So welcome everyone. Today is the second day of the thesis protocol writing workshop. We are also learning actually how to use technology. So there might be certain glitches. Yesterday some sound issues were there, audio issues, and we don't know what is going to happen today. We are keeping our fingers crossed. We are heavily dependent on technology, internet, mobile phones, laptops, how they will function, where what glitch may happen. So please bear with us. Don't panic in that sense, and it is not the first and last time that we are meeting. We are in college only, and you are in college only, and all the facilitators are in college only. So there is no issue. The dialogue will continue. We will continue interacting. ऐसा नहीं है कि अगर online connectivity कुछ problem हो गई, then we don't feel lost at all. We are not going to leave you. You are not going to leave us. So I think today we will be starting with the first presentation, writing the introduction in your thesis protocol, and also the review of literature. What are the things that you should keep in mind when you have to write these two things in your protocol? For that, I would like to invite Dr. Sandhya Jain. She is in gynecology department, and she will be taking you through these sessions. So I invite Dr. Sandhya. Dr. Sandhya, you are the presenter now. You can share your screen and interact. Thank you, Dr. Sandhya. Yes, your screen is visible, Dr. Sandhya.
Okay, thank you, Dr. Amir.
Audio is also clear. Please go ahead.
Audio is also clear. So I just show my face once and then I can. Hello, everyone. Good evening. And I have to take, I'm the opening batsman for today evening. We'll be talking about introduction and review of literature with you so that when you go about to write it, you are comfortable. And I have a sample protocol also with me of my own PG, which I can show at the last. So actually, yeah, I'll just switch off the webcam now. I'll be more comfortable. So well, begin is half done. And a good introduction will actually keep the reader hooked to your thesis. And in fact, you feel good when somebody compliments you. The other day, one of my colleagues, who's herself a great researcher, just was going through my thesis, and she complimented me that she was enjoying my thesis. What I loved the word was actually she was enjoying. Normally, we don't enjoy reading a thesis. Normally, the tendency is just it's there, we have to do it, and we have to meet the deadline and everything. But I feel that over the years that it's an opportunity to expand your mind, to express your views, and a great laying stone for future research potential. Over the years, I've become more vivid in my approach and ideas, and in fact I've started enjoying the thesis work. So that's how it is. Hope it becomes the same for you all. I move the slides. 1 second. Yeah. So scientific research is a journey from known to unknown. It needs a thinker mind and a passionate heart. Sorry, 1 second. I'm showing myself. 1 second. Yeah. And everything evolves around a good research question, and as to why we are trying to do this research. And so everything, introduction, review, methodology. So a research question has to be very clear. You have had class on that, and I'm sure that each one of you by now has a research question in the mind, or your guide will clarify your thoughts further. So introduction is the very first thing or a part of the thesis. You all will get a protocol writing template, and you will see that it's one of the first things to be doing. So it is to acquaint the topic to the reader and provide background information, crisp and arouse interest in the topic, The area of study should be specific and clear, as I told you. And once the reader is going through the introduction, they should have a gist of what you're going to do, and convince the reader actually that yes, this research is justified. It's not that much there in literature, and more work needs to be done on it. So that's how it is. The introduction must answer these questions. It should include what is the research question, and why it is important at the moment, and what do we currently understand about this issue. What is our based on the current literature, how much we know about it, what are the lacunae in the knowledge, can we add further to what is already there, and what are we going to study this time in continuation or something different. So it's the funnel approach. As you can see, it's in a shape of a funnel. This is how the introduction goes about. This research question is specific, but you start with a general background pertaining to that particular topic. If I have to talk about role of ultrasound in obstetric anal sphincter injury, I have started with why obstetric injury occurs, what is the incidence, and then what are the symptoms, and then the question is specific. I want to study the role of ultrasound in obstetric injuries, and I start with obstetric injuries in general, and then proceed further. Then I go on to the brief statement regarding existing research work, whether any researchers has actually worked on this aspect previously, and what are the kind of studies available in the literature, what are the routes of ultrasound they have used, I mean, which way, all way, transperineal, transvaginal, how they have transrectal, how they have performed this research previously, what are the lacunae, have they compared those different techniques, or which one is better, and or have they improvised with their probe or the ultrasound probe, whether they are using 2D probe, 3D probe. So there is a lot of potential. Actually, research is endless. It has to come to your mind, and you just have to implement it. So lacunae, some lacunae which you can obviously see and feel, and some lacunae which, as your mind expands in the research, you sort of want to do this thing. I want to. So you can be a pioneer. It could simply be a pilot study or a proof of concept study, as it's called sometimes, and then you may be the first one doing that research. So actually, lacunae may be there compared to previous study, or it's something just out of your mind for the first time. And then finally, you come down and you touch upon that specific thing that I want to do it this time, and why I want to do this thing this time. So this is the typical funnel approach for introduction. It should help you now to write the introduction. I have an example with you. It's one of my own thesis, and I've tried to make a funnel out of this introduction. We did symptoms in ovarian cancer. Actually, ovarian malignancy, there are no typical gynecological symptoms like abnormal uterine bleeding or such thing, and these patients have very non-specific gastrointestinal symptoms. Based on that, there is a symptom index which has been done very few times in previous studies. So I was just going through the literature, and these patients present very late. So this is just how we started about it. Since we were talking about in the context of ovarian cancer, I started as ovarian cancer is a dreaded gynecological malignancy with an average incidence of, so I can put a reference there. And then next slide, most of the patient present to the specialist in advanced stage due to late detection. I came closer to my topic. As the symptoms are non-gynecological in nature, they are often ignored by the patient and the doctor. And then the lacunae part. Very few studies have studied use of symptom index for early detection of ovarian cancer, which includes a variety of symptoms. And then no Indian studies available, not even one was available when I did this thesis. And then I come to my specific aim or the objective of the study. So this study aimed to evaluate the role of symptoms in ovarian cancer presentation for early detection in Indian women. So that was finally my sort of aim or objective. And the same, more or less the same went when I went to write aims and objectives as a separate section of the thesis. So it's very important that the aim or objective that you write here matches with the aim or objective which you put it in the section of aims and objectives. So you now have a fair idea about the structure of the introduction. Don't forget the funnel. So you'll put the most general information about a specific problem. Research question cannot be very vast. It is specific. Lacuna in the current status of the knowledge. How do you plan to approach it? I mean, why do you want to approach and why? And then you state the specific purpose of your study or the hypothesis. I have another example for that for you. So this was the exercise that it's another of my thesis only. So we want testing the effectiveness of barium carboxymaltose injection in treating postpartum anemia. Now, postpartum anemia is a definite entity where hemoglobin in postpartum period is less than 10 gram %. And you know how many Indian women are anemic. We have been using oral and parenteral iron, but there is a newer form of parenteral iron, barium carboxymaltose, FCM as we call it. It in a higher dose it can be given and rapidly causes rise just by one shot of 1000 milligram. So I thought I should test it in postpartum women and compare it with the oral iron as we routinely give in postpartum women. So when I approached the introduction, the broad context I started with, what first thing was the definition of postpartum anemia and the incidence. I quoted a reference for that. And then I did also talk about the prevalence and why it was high because of non-compliance with oral iron. And then I switched over gradually to parenteral iron, that it is better over oral iron. What are its types? What routes? IV, IM, whatever ways we can give parenteral iron. And then I touched upon the new molecule. This experiment will study new FCM injection to correct postpartum anemia. And then my specific research objective to compare efficacy and safety of. So this study was conducted to compare the efficacy and safety of parenteral FCM injection with oral iron therapy in treating postpartum anemia. And the hypothesis was that parenteral iron is better than oral iron in treating postpartum anemia. So that was briefly 2 examples of how we can write the introduction. At the end of introduction, we have we may or may not actually mention the column of lacunae in existing knowledge. It comes in just 4 or 5 lines. And the same thing which we have just put in the introduction somewhere, we can objectively, in clear words, we can put in lacunae in the existing knowledge. I'll show you my protocol, one of them, and then you can know that it may be added at the end of introduction as a subheading, and then you can put few lines underneath. So as you see the protocol template, it gives introduction 2 pages. So 1 to 2 pages, max 3. More than that, really not required, and the reader gets bored. You have to grip the reader tight from the beginning, as I told you. I mean, they should enjoy your writing. Then ideas and information should flow smoothly and logically. It has to go in a story-like fashion, logical sequence, as I told you, few examples. Of course, no grammatical errors, and provide evidence supported by limited number of relevant references. I don't want to put 10 references in my introduction. I may have 5 to 6 paragraphs and then 3 or 4 references. There are no set standards, but we can keep it for a few important like incidence and definitions and 1 or more primary study if we are quoting right here. So that should be enough. Rest we can put in review of the literature. So not too many references should be put in the introduction. Hope I'm clear till now. It shouldn't be excessively long. There should be no extensive listing of references. We have talked about it. We should not, this I have seen with a lot of PGs. If I'm saying that FCM, my hypothesis is that FCM injection is better than oral iron, I will keep on praising parenteral iron all my introduction and thesis. I will keep on criticizing oral iron all my thesis. That is precisely not, which is not to be done. A researcher works with an open mind. Even the negative findings I may find in my research, that oral iron turns out to be better. The safety profile is better. Orally also it's equivalent. So a researcher has to keep this in mind, that the results may go this way or that way, and both are equally important. So we need not praise one aspect of, or the one kind of result that we are desiring to achieve, and never extensive critique of the other work should be avoided. Then it should not be that some very important work or a primary literature is available which we have completely missed. That should not be there. So we have to be a real hunt on the, Google pe baith jao and just sit and take out articles. It is also an art. Over the years you will learn that you will be able to just dig out those articles which you need, which are required, which are relevant to your research. So need not miss important research work, because it will be really a great help in sort of framing your own protocol. And then for sample size evaluations, you need some previous relevant work, as you will be talked about, you'll talk in a statistics portion. That's how. So ill-defined research question is again a big no. It has to be very clear, very specific. And I told you the aim put in the introduction section has to match the one which you later on put in the aims and objectives section. And there should not be a premature statement about your conclusion, like you have fixed in your mind that FCM is better in postpartum anemia, and you start saying that I am hereby to prove that parental iron is definitely better than oral iron, and it will cause at least a 3 gram% rise of hemoglobin. So that kind of thing has to be avoided. You have to work with an open, unbiased mind, and any kind of outcomes are important, and every research work has a journal. So nothing to worry, each and every research will find a journal to be published. With that, I end with the introduction part, and we go on to the review of literature. It's the, I think, one of the most bulky part of your protocol, because you'll be digging out articles, and you will have a big bundle with you, and then you will read each one of them. You will sort them out. So, and then you will mark and mark, and then you will take out words and what analysis they have done. So review of literature, it's very time consuming, it is important, and it is the main sort of bulk of the thesis protocol. So what do we aim when we want to review? We want to review the critical points in the current knowledge, what is there available, and we want to critically now see, keeping in mind our own research question. Then justify need and lay groundwork for the present research. So has FCM, are there too many studies on FCM? In fact, if I'm finding too many articles on the Google, then better not do that research. A lot has already been done. And if you find a meta-analysis or something, definitely don't do it, I think, because meta-analysis means it has been totally, the subject has been dealt with nicely in literature. So do something different, something new, something fresh. So you need to see that is there a need, and then if there is a need, then this research, whatever you get, will help to lay the groundwork for your own research. It should bring clarity and focus to your research question. Your thoughts and the thoughts of people all around the world, are they same? What difference is there? So that you on an international platform, so improve the methodology. You can take tips from the methodologies and statistical tests they have used, what kind of tables they have created. So that improves your methodology. It involves gathering the literature, reading them, nicely, analyzing them, and evaluate them and summarize them. That is how it logically goes. So the reviewing process involves identifying main themes, concepts, discovering relationship between sources, and identify critical gaps and disagreements. So like this, there are gaps and research fills in this gap. I like to do this in my thesis. I when I study a particular aspect, I studied obstetric anal sphincter injury syndrome, and I did two things. I did the role of ultrasound in the evaluation, and I also did about the symptoms and how the patients with or without sphincter injury um, uh, uh, did. After 6 weeks of delivery. So you can link. There are many missing links. Let me tell you, literature is endless. Research is endless. So you can find the gaps and try to fill them. So, for example, some studies regarding endometrial cancer, they say obesity is a risk factor for endometrial cancer, and then there is a marker uh, uh, where we measuring levels of a marker in obese and non-obese patients, and we found that that marker was very high. It was some biochemical marker which was very high in obese patients. So can we say that this marker may be a predictor for endometrial cancer? So first I will see studies where they have seen the marker levels in obese and non-obese patients. That obesity is a risk factor for endometrial cancer is already well established. Now I plan to see the level of these markers in endometrial cancer patients. And if they are found to be high, sort of, so we will have a kind of predictor for endometrial cancer. So in high risk women, we can do surveillance with this marker now. So that's how it goes. Another one is pesticide levels are high in agricultural workers, we know. We have also found out that pesticide levels are high in urinary bladder cancer patients. There's a metabolizing enzyme for these pesticides which inactivate it in the body, and then there's certain genes which control the activity of these metabolizing enzymes. So there are four separate statements. Can we find a link that we have seen? So is the incidence of urinary bladder cancer high in agricultural workers? That itself is a complete research. I can just simply take all agricultural workers and see the incidence of bladder cancer. Then I can measure those enzyme levels in urinary bladder cancer patient, whether they are low. And then because these are metabolizing enzymes are required to inactivate pesticides in the body. So are the levels low in urinary cancer patient? That's why they accumulated pesticides and developed the disease. And then we can also measure the gene activity. So our biochemistry colleagues, actually we do collaborate with them many times, and we sort of we have some clinical aspect in mind, and they give us inputs with the biochemical or other paraclinical departments, and it's a great support from them. So what is the literature? Any scholarly writing on a topic is a literature. I think you must have dealt with it in your biomedical research section. I don't know, but I'll just briefly touch upon it. It could be an article in a journal, some book, some conference proceedings, meeting proceedings, or any thesis or dissertations. Dissertations are also long as essays, kind of a thesis kind of a thing, for written in for university curriculum. The way it's like thesis only. So it's a primary, secondary, or tertiary. Three kinds of literature are there. Primary literature is original work, primary, so it could be an original study. And if it is there in a good journal with a high impact factor, a good scientific journal, I can count on my fingers 10 obstetric gynecology journals, which I'm very sure the articles published in them would be peer reviewed. They would be of very high quality because the journal has a good impact factor. And then so it could be case studies which may or may not be peer reviewed. Then conference proceedings, sometimes all the abstracts are compiled and they are published in the supplementary issue of the journals, but they are original work. and then meta-analysis. So I hope you all understand what is an impact factor of a journal. It's very important as you start doing your research, you look for quality. You look for a quality journal with a good impact factor, and it's I'll just define that. So impact factor of a journal is based on previous 2 years citation. Citation is how many times the when all the articles published over last 2 years in that journal, they must have been used and quoted by other various studies and articles in the literature. So how many times that was done, divided by total number of articles published over 2 years, that gives the impact factor for the current year. So if we want to calculate for current year, we have to have information for the past 2 years, all that was cited world over, divided by all that was published in past 2 years. Then secondary literature, a review article. I really like review articles, up to date and all. Sometimes, I'm looking forward to finding them, and just they're written by experts. They're good points to start reading literature. It needs less effort because part of the homework has been done. Somebody has, reviewed everything. Suppose it's August 2020, so I'm sure that they have looked at all the previous work, especially important primary work, and they have not missed any. And my job becomes easier, and I can simply find cross references. I can see the reference list in that article, and I will try to find the original articles from there. Then they have discussed about there must be consensus disagreements. They highlight the strength and shortcomings of each study. So my job becomes sort of little easier. So from a review article, I can move on now to searching the primary literature, and that I can use as my parent article, as I call it. So one or two articles you would love to have them before you have a research question. You find go for a literature search, and one or two articles you just feel very nice to see them, and you say, oh, this is the parent article, I'm going to follow this one and use this one to when I start writing I get ideas from this research. So it review articles also gives direction to future research, and even from thesis and dissertation, whatever literature you get comes in secondary literature. Now tertiary literature is our textbook, the standard textbooks. We have Williams, we have guidelines like RCOG, ACOG, American College of Obs and Gynae. They constitute tertiary literature. They're good for references. There is no need of any critical analysis. They are there, they are standard, and they cannot be quoted. You can just quote them and use it. They should not be extensively reproduced in writing review. That means you cannot copy paste portions from them and put it in your protocol. You just put a line, put the reference, and somebody who wants to refer can directly refer to that guideline, right? So there is a network of literature. You have to should not miss the major works that is available in literature. So you should be good at Google search, and then there are studies which are offshoots from that article. They will also help you to take your research forward, give you ideas. So एक idea ही दुनिया बदल देता है ना आजकल. तो it's all about idea and information. So the more you get ideas within yourself from Google, the more your mind will expand, and you sort of so this is how you go. So you sort and prioritize the reviewed literature. You have 20 articles, but 3 or 4 you would really love to keep them at the top. So in the order of priority, you can sort out those articles, and then you will critically read them. As you start reading for the first time, I would suggest just take a pen or a marker and mark important thing right there. You can put an asterisk, you can put a dark line, so that you don't for the first time only you have sort of marked important things. Then you compare across studies, whatever is there. You organize the content, that the picture starts forming in your mind. The mind is like that. As you go through these literature articles, a picture will start forming in your mind already, and you start writing the review. Over here, I just want to say a word that it is written, even Dr. Piyush sir, I was just going through the book. It is written that introduction should be written after actually you have done the review of the literature part, because you have done you only do extensive research and the search through Google and all while for the review. And once you're done with the review, actually the picture is clear in your mind, and it's much easier to write the introduction after you are through with your review. So that's how it is. So identify most recent review article, and then identify most important primary articles from the references that are there in the review article, and then identify secondary studies from those primary work. So it's all connected. And then some areas you will find that some work is already done, some more needs to be done, or something, some other bulb switches on in your mind, I want to do this, and there is no end. You can do your own pilot work, and you be the pioneer. So the starting process, there's an intro in a review, then there's a main body, and then there are conclusions and recommendation, and you smoothly go on to the next section of aims and objectives. So it starts with intro, followed by review of the literature, followed by aims and objectives, methodology, results, and all this. So you will get the template for that. So in writing the introduction, it's just a one paragraph thing which revolves around your research question. You will give a general statement about and put your research question, define key terminologies and abbreviations. If I use vaginal hysterectomy, I'm planning to do work on that, so I'll put bracket maybe VH, and then I can, for the rest of the study, instead of putting long words, use that abbreviation, and then adequate references as we go. The main body will be articles. Those articles, you can't put everything in the protocol. Writing big thesis is a separate thing, but for the protocol, you have to really choose. We can't put 40 references in the protocol. I think 10, 15 should be good. I didn't find exactly the upper limit, but I generally put up to 15. And then those are the important articles which sort of relate directly to your work. So if I'm working on ultrasound and the scores, the pelvic distress scores, so I will take 4 or 5 articles related to ultrasound in sphincter injury, 4 to 5 articles on the symptom scores, the pelvic floor distress inventory score. So I mean, depending how many themes I have in my review, I will put 4 or 5 references for each, generally not more than 15 I put. So you summarize each article. The idea is so as you get an article to read, go through the abstract first. Every original research has an abstract right in the beginning, which is just the summary of the whole thing, and it will really give you an idea. And then you can go through that, and then you can read the article next, and instead of copy pasting the information, just make a gist of it, and to take those points which are important from, like if you're working on some particular aspect, you're working on some methodology, so concentrate more on the methodology in that study. So if I'm concentrating more on the outcome, some particular outcome, levels of iron, hemoglobin after iron, parental iron, so I will concentrate more on outcome. So in the summary, if I am summarizing each an article, I will put those things which directly relate to my research question. It can be chronologically, year-wise, starting from earlier to the latest study. So 2019 study will come in the last. So we can arrange them like that. And we can also keep it theme-based. I put 4 or 5 headings in the review. One is the risk factors for sphincter injury. One is the role of ultrasound. And then what are the pelvic floor distress inventory scores and separate studies. So I can put it theme based. And then within each, I can arrange articles in a chronological order. I can also put it like if I'm studying periodontal disease in relation to preterm labor, I can put all the articles which say that yes, periodontal disease leads to preterm labor, and in the second half I can put all the articles against it. Sometimes I also tend to make a table which is if there are many articles sort of, so it's easy to put a table which is very explanatory. So no detailed comments, all the discussion will rest will go to the discussion part, but here it will be, because you get in review 4 to 5 pages, and in the template it's even less, so no detailed discussion possible here. You just can't do this here, and avoid copy pasting as I told you. In the conclusion, you will again revolve around your research question that with all these study there is no enough consensus in the literature about the role of periodontal disease and preterm labor. In this research, I propose to do this and using this parameter, something like that. So you can sort of nicely close your review of the literature. So I think I have some time, Dr. Amir. 10-15 minutes you will give me. Uh,
Yes, you have 10
I'll
minutes.
take just, yeah,
10 minutes
just
you
that.
have.
In fact, 10 minutes I'll finish it off.
Yes. Yes.
So
Thank
there
you.
has to be focus. Sorry, it's Uh, if you are a clinician, I'm mostly interested in outcomes. If I give a treatment, I want an outcome that iron, if I give iron, hemoglobin should rise. So depends. So my focus is on outcome. My paraclinical colleagues and friends, they might be interested in a particular methodology or a test they want to compare the efficacy or whatever parameters they use. So their focus is on methodology. Social research on prevalent practices, maybe my community medicine colleagues and friends would like to work more on this aspect. So depends. Again, everything revolves around your research question. Don't go too lateral from your research question. It's not required. And then there experimental research based on both methodology and outcome. So you should be clear that my research question is this and I want to concentrate on this aspect. Perspective, preferably neutral, as I told you right in the beginning. Don't favor a particular theory. Don't work with a biased mind that parental iron will increase hemoglobin. How it cannot increase? It's not possible in this world. So be neutral. Oral iron might just turn out to be better if you see overall. So don't criticize, be neutral in your approach. Keep a balance of studies which are for and against. Don't put 20 studies of with it and 2 studies which are against it. Coverage. In protocol, you can't be exhaustive. You have limited space and this thing. So you have to be selective and focused, which preferably meta-analysis and well-designed research articles that we have talked. And then the organization, I have talked to you about it. It can be chronological in the time frame, I mean earlier to later, depending. I'll just show in the next slide. Conceptual or thematic organization, depending on creating subheadings, and underneath that you can have chronological arrangements. And then a methodological arrangement, which is nothing but the way we write the whole protocol, like intro, review, methodology, results, like that. So in methodological section, you write the body of the review in that pattern. So you can compare the, suppose it's introduction, you can compare the incidence and risk factor, various studies right there. Then you come to the other aspect. And so this is how, it's just the way you write the protocol. So chronological order, year-wise you're going. And then in the thematic, you have put risk factors, then you put another subheading. So under these subheadings, you work. So how do you compose the literature review? Select most important points from each source. As you read for the first time, take a pen, a marker, and mark it right there so that you don't struggle to read next time. So take important information from wherever you can get, summarize in a paragraph, rephrase. It's very important not to cut and paste. You have your own unique style of writing. If you take too much of different work and cut paste, it will not be coherent and nice to read, because every reader has a different style. So maintain your unique style of writing. uh, that is possible only when you rephrase the whole portion of as a summary and rewrite it, stressing upon important points, keeping in mind the research question. Use past tense when presenting source data and use present tense when presenting your own ideas. That's very logical. Do not give a summary paper by paper. Critically evaluate the results. Use subheadings to identify themes. Try and create a logical progression. That's very true. Sorry. And then hierarchy of information and literature review. So I think these are just examples where endogenous and exogenous risk factors for cervical cancer, you have subdivided into themes, and under each theme you further subdivided, and then you can put things in chronological order. It's just an example. So I had this slide I thought I can share. So cancer, this exercise of writing subheading. So cancer chemoprevention by grape seed and cranberry extract. These are fruit extracts. So you can start by mentioning the basic principles of carcinogenesis, and then the cancer epidemiology can be another subheading, and then chemo prevention, what are the things available, including fiber, micronutrients, how does chemo prevention, which way it works. And then you can come on to the extracts of fruits and methods to prepare them, and then later on. So just frame it in your mind and you can start writing it. You can also combine two paragraphs when you write when you want to uh, write the review. You can compare two studies with different outcomes. So X in 1992 studied the beneficial effects of cranberry extract for 10 years in workers of chemical factory and found a 15% reduction in the risk of urinary bladder cancer. In another study before that in 86, Y studied protective effects of cranberry extract in industrial workers at the risk of development of bladder cancer, and after 2 years they did not find any difference in the occurrence of bladder cancer. So we can write two earlier studies have evaluated the efficacy of cranberry extract in individual at risk of developing bladder cancer. X found a 15% reduction in the occurrence of new cases of urinary bladder cancer in study group as compared to control after studying the cohorts for 10 years. However, yeah, in contrast, Y studied similar groups at risk for 2 years with similar intervention but failed to detect any risk reduction in the cohort. The difference in follow-up of the cohorts, that is 10 years versus 2 years, may explain the difference in the two results. So it's like just reframing everything in your own words and just put a one-line logic below it. So there are immense ways you can write instead of copy pasting. You can do these kind of things. So I think we can just acha, this is just like they're haphazard lines. If I go to read just like that and put introduction like that, I think my thesis will be rejected at the introduction part only. We have tested compounds for inhibitors of P. falciparum intraerythropoietic cycle. New class of antimalarials have been introduced into clinical practice since 1996. Malaria is one of the most severe infectious diseases. This paper describes 32 compounds confirmed to inhibit parasite growth, blah, blah, blah. Resistance is being reported to artemisinin. Absolutely non-coherent, uninteresting, cannot be enjoyed. But if you put it in a logical sequence, like malaria is one of the most severe infectious diseases, no new class of antimalarials have been introduced into the clinical practice since 1996. Resistance is being reported to artemisinins. We have tested compounds for inhibitor, and so this paper describes 32 compounds confirmed to inhibit parasite this. So as you can see, it's more logical and interesting to read. So I really suggest all of you to just keep these points in mind when you write your intro and review. I can just show my protocol once, Dr. Amir. One of my protocols, I just opened it and highlighted few things. Am I audible, Dr. Amir?
Yes, you are
Hello?
audible.
And
Yes, you are
the
audible.
screen, okay, the screen
Yes,
is
yes,
can be
very.
shared, no?
Yes.
Fine. So
The
the
word.
title of, yeah, the title was of, this is one of my, this is completed thesis now. So detection of occult anal sphincter injury in primary para by 2D transperineal ultrasound and its clinical correlation. I was working around occult anal sphincter injury syndrome, and I studied two aspects: one, the role of ultrasound, and another one, the clinical correlation. So my title is quite self-explanatory. You have a separate class on title writing. So introduction. I started with sphincter damage. Anal sphincter damage after childbirth is an important etiological factor for anal incontinence. Then I talked about incidence and the chances of developing new onset bowel symptoms after childbirth. And then I defined what is occult injury, because I've used that in my title. I defined it that any damage that is not apparent on clinical examination is occult. So you see, I've started with general sphincter damage, the chance of new onset symptoms, the incidence, come to the definition of occult injury right there, so that my reader is not confused. What is she talking? What is occult injury? She put such big words in the title, but there is no mention in the introduction till the end. So whatever I'm a gynecologist. Even my gynecologist colleague may not understand occult injury, what to talk of other specialities. So when we use certain words, the definition and explanation should come right in the beginning. It's like a story only. Then I've talked about risk factors, and then I've just put it a table to make it nice and clear that these are the classification of injuries. And then I've touched upon ultrasound. Mind you, that was one of my parameters, as you saw in the title. I've touched upon the variety of ultrasounds, and then I have come on to the my specific transperineal ultrasound, which I was interested in doing. So from general to transperineal ultrasound, and just I put one or two pics to make it nice, and to see how a sphincter looks on ultrasound. And then this is what I was talking. At the end of introduction, you can put a lacunae in literature, separate heading, just 3 lines. Literature has only few studies regarding detection of occult injury using 2D transperineal ultrasound post-delivery. None of these studies have correlated obstetric anal sphincter injury or OASI with its clinical symptoms, and no Indian data is available in this regard. So you can conclude the introduction by a lacunae in this, and then of course this is followed by review of the literature. So I can just take 1 more minute to end here, that I started again with the injury to the sphincter. Childbirth is common, then various ultrasounds are available, and then recently transperineal ultrasound, my topic of interest, appears to be promising in diagnosis of sphincter. And then I've divided the topic thematically into studies relating to the incidence and risk factors of OISIS, which I've given year-wise insight. Then my another subheading was studies on ultrasound techniques for detection of sphincter injury, and I've given subheadings chronologically. My third headings was studies on clinical assessment on pelvic floor and anal function, again a subheadings. And that's how I ended in 4 to 5 slides. So that was my protocol, and with that I conclude. Dr. Amir, I want to thank Dr. Amir and the entire MU unit for this opportunity, and that's all, Dr. Amir. I will
Thank you, Dr. Sandhya. You finished well in time. Actually, we started 5 to 10 minutes late. That is why I gave you that 5 to 10 minutes extra. And now, so we are well in time. So I would like to start the next session also. So the next session. Thank you. So the next session is by Dr. Rajarshi. He will be talking about the material and method section in the writing protocol. So I would just Dr. Rajarshi. So I make presenter. So Dr. Rajarshi, I think now you are the presenter. So can you? Yes, I think that's good. Okay, so over to you, Dr. Rajarshi.
Thank you, Dr. Amir, and good evening to all of you students. So I'll be talking about sorry for that. So I'll be talking about one of the most important part of protocol writing, and which will remain unchanged when you write your thesis also. So that's the material and method. So that is the most important thing you have to keep in mind, that you have to be so careful while writing the material and methods that you have to bear in mind that it is like patthar ki lagi, means once you have done it, once you have written the material methods and submitted the protocol, you are not allowed to change it. And so you have to be absolutely sure before writing it that this is how you want to proceed. Sometimes it happens that you have selected a method which is not working. Down the line, you find that it's not working. But changing it is a difficult process because you have to write and take an permission to change that. So it is always better that before you write your protocol, you actually evaluate the method which you want to do. But most of the time, it is not possible. You go ahead blindly. Practically speaking, it is not possible to evaluate all the methods you do. Like, for example, if your thesis is collaborating with biochemistry and you are doing ELISA. So the ELISA kit is very costly in itself, so you cannot actually try out the ELISA. So the best method is you ask your guide or co-guide, whoever, like if you're collaborating in pathology or in some other department and you are doing a method, obviously you will not know that method. So you have to ask your co-guide that whether that method has been standardized or not. Many times what happens, your co-guide may be over enthusiastic and more adventurous and may take up a project which has not been standardized, and then you are the person who is at a fix. At that point of time, your thesis will be suffering if that thing doesn't happen. Even if so, you have to put your foot down while writing these material methods that, ma'am or sir, whether this is possible, whether you have already done it or not. So that you have to ensure before committing yourself to any methodology which you want to put in your. That is my personal advice to all of you. Be absolutely sure about the methodology which you want to follow before committing to yourself in the protocol. The next, now what we will do, writing the material and methods is very easy because writing the material and methods is very easy. You can actually because there is a set pattern in which you have to write it. So you don't have to bother about it, and you can start writing your protocol by this. After you have a research question in your mind and you are continuing writing introduction and review of literature. In the meantime, you can also finalize the material and methods after you have spoken to your guide and co-guide about what methods you are going to follow, because that is directly linked with your research questions and you don't have to depend on the introduction and review of literature to write the material and methods. So it's the easiest part, but the most important, and you have to be very careful while writing this. So you have to start writing the material and methods with a basic information, which will include the place of study or the setting, the study setting. So where the study will be carried out. You have to give the details of the primary department, like which department you belong to, and all the other departments from where you have selected your co-guides for doing this study. Then you have to mention the duration of period, like from when to when. So it's usually same for all of you. For this batch of PG students, it will be same from say the time of your joining till the submission in 2 years down the line. Then what type of study you are doing, whether it's a cross-sectional, longitudinal. So this will also be taken up in details. I'll not go into it. And then the most important part is that you have to mention that we will be taking ethical, because this is all in future tense. So when you're writing for the protocol, the only difference between the material methods of protocol and when you submit a thesis is the tense. Otherwise, everything will remain the same. So this will be written in future tense. I'd ask you, all of you, to be on mute. I request all of you to be on mute. So the ethical things you have to write in future tense. I'll just give you an example. So here you can see the place of study. So this was a thesis from the Department of Gynecology in which I was a co-guide. So biochemistry is mentioned, and then there was some work. Some of the work was done in pathology. So all the departments' name is mentioned, and of course So you have to write. So you have to. Was I muted? Did I miss some part, Amir?
Yes, when you started this, I think there was some mute issue was happening.
Okay. So this slide,
Just
right?
yeah, this one.
So this is
Just a pic-
I'll just repeat this once again. So
yes.
this is an example of a thesis. This is not a protocol. This is a part of the thesis. So this is it's a good idea to actually break it down into subheadings, but you can also write it in the form of a paragraph. Like all this basic information, place of study, study design, study duration and concept. All of this you can write in the form of paragraph, but it's good and it's easier for the reviewer eyes if you split it down like this into subheadings. And you have to mention the departments, as I said, where it is being done. Then a written confirm, this is obviously in the past tense because it is from I have taken it from a thesis. But in protocol, you write a written informed consent will be taken from all patients and ethical clearance will be obtained from the institutional ethical committee. But here there is a mistake. You will have to write you have to write the college name also. Okay. You do not take it for granted that it is the institutional ethical committee is of UCMS. You have to write because sometimes some studies may be you may also have to take samples from say cancer institutes. In that case their institutional ethical committee's appearance is also required, so you have to mention from which institute you are taking the institutional ethical clearance. So I don't know whether you have been introduced to the term PICO, population intervention comparator and outcome. So that is the basic things you have to keep in mind while you are preparing a research question or you are making a title. So designing a title will be taken up I think down the line. So here also you have to see whether you are fulfilling those 4 points. That is, you have described the population, you have described or you have taken care of what methodology you follow for the intervention, for the comparator or controls, and how will you measure the outcome. So all these 4 points you have to keep in mind. So in population you will have to mention the sample size. That is the most important thing, that what will be your sample size, what will be the number of cases, what will be the number of controls, and you can write the basis of how you calculated this number. So all of you will now rush to the statistician for doing a sample size calculation. We will also have a session on that also. So once you have done, you have to write a paragraph on this, like how you have arrived at this sample size. So that either you can put it here or you can put it at the end of the material and methods. I'll show it where else you can put it. Then the place from where the subjects will be recruited. So you cannot just say from UCMS. You have to specifically mention whether it is from the medicine OPD, ENT OPD, or gynecology OPD, or you will take you will recruit the patients from the OT or from the indoor. So that details has to be given here. Then how will you do the sampling and what will be the inclusion criteria and the exclusion criteria? So inclusion criteria, usually you have to define the ages, like whether it is children. If it is in children, so you have to say from 5 years to 12 years, or in adults from 20 to 60. So you have to give a range of age. That is important. And the criteria for defining the disease condition, like if you are saying that I will take patients with metabolic syndrome, so you have to define which definition of metabolic syndrome you will follow to decide that yes, this subject is suffering from metabolic syndrome and I want to include this in my study. Then you have to also mention the exclusion criteria. Now here you have to keep in mind, which most people make a mistake, is they just write the opposite of inclusion criteria. So it's not the opposite of inclusion criteria. Like suppose if your inclusion criteria is age 20 to 40, all males from 20 to 40. So you will not write in your exclusion criteria all females or all those who are less than 20, more than 40. So it is not the opposite of inclusion criteria. Exclusion criteria is those criteria which a subject who is fulfilling the inclusion criteria, means otherwise you would have included him in the study. He is in 20 to 40 years age group, he is a male, whatever you have said, or he is suffering from that metabolic syndrome, he is fulfilling the definition of metabolic syndrome. But there are some things which may include a bias in your study or which may affect your outcome measures. For example, if you are doing metabolic syndrome and he is already on metformin, a drug, so that drug will obviously impair or will somewhat treat the metabolic syndrome. So in that case, that will introduce a bias of between the patients who are on metformin and who are not on metformin. So that you have to decide whether you want to include all patients, and then you have to again make a subgroup of patients with or without metformin. So it is better to avoid someone who is on medication. So you have to decide which medications will affect the outcome of your study in those. So those can be an exclusion criteria. Or if you are studying on hypertension and the patient is having a renal disease, so that will also contribute to the hypertension. So if you are studying on essential hypertension, so if a person is having renal disease, that will be a compounding factor. So you have to exclude those. So those are that is what is meant by exclusion criteria. So you have to carefully decide on that. Same things have to be used for the control or the comparison group. So comparison group will it can be matched or it can be unmatched. So a matched is very difficult, and you are sitting in 2 years you cannot do. Then if you are doing a randomized control trial, then you have to describe the method of randomization. It's very rarely done in for an MD thesis, but you should be knowing what is a randomized control trial, and if you're doing some drug trials, so it's usually a more complex thing to do. But most of the thesis will not have a randomized control trial, but some of you may have. If it is a procedure which you are comparing surgery, so then maybe that can be a randomized control trial. So again, there you have to describe the process of randomization and whether you have done blinding or not. Blinding means you don't know which patient is receiving. No, that is during the process of randomization. You conceal the randomization process. So one who is recruiting doesn't know which patient will get what treatment. And blinding is when you are measuring the outcome, you do not know which patient's outcome you are measuring. So that is blinding. So these details you can read through. So this is an example how you can write the study population, all women with this and that. This diagnosis will be included. Now, inclusion criteria: women with histologically confirmed malignant, borderline, benign epithelial ovarian tumors of all age groups. Exclusion criteria. So here, can you point out the mistake? What is there? You can write in the chat box if you want. I'll give you a moment.
The students can write in the question box. That is the
Question
option
box.
available in the mobile also.
I mean, can you just check whether anyone is responding on that?
Yes, I will tell. No one has responded till now. They have to identify the inclusion and exclusion criteria thing, right?
What is the mistake there in this one? I just said
And
something about exclusion
the
criteria.
participant can even raise hand if they want. So one has mentioned that point one is not an exclusion criteria.
Very good. So that is
Kumari and Hemant Soni have mentioned the one Vaibhavi Shetty and Koyal Mukuti, that the first one is just the opposite of inclusion criteria.
very good. Yes. So that is what I wanted to clarify, that exclusion criteria should be only applied to those patients who fulfill the inclusion criteria. Here, ovarian malignancy other than epithelial ovarian cancer is this itself is not an inclusion criteria, because we are studying epithelial ovarian tumor. So we cannot take other patients. So that is not an exclusion criteria, right? And good. Now the intervention and the procedure. Now, moving from P to I, this can be of different types. Like it can be a diagnostic. So most of you will be doing this diagnostic, or interventional also you can be doing, but mostly drug trials are not done for an MD thesis. And observationals also most of you will be, but most of you will be doing some diagnostic tests or the other, some ultrasound or a biochemical test or routine lab investigations. All those will be included. So you have to write in detail about this. You have to write the detail of the methodology if it is a new method. If it is an old method, like if you are doing RNA isolation, you can quote a standard reference. Like RNA isolation will be done by the column method and as described in this article. So you just give the reference. In protocol, you don't need to go into the detail, but it is always better in thesis that you describe the procedure, so that the thumb rule is that anyone picking up the thesis and trying to replicate should be able to do so without looking at any other journal. So that is the level of description you should give. Now, if you are using a standard reference and you have modified something in it, then again you have to describe the modification with reference to the standard or published method. Then you have to be very careful about the volume, masses, incubation time, so that a small blunder in this can make a huge difference. Like if you are saying that I will take 5 ml of blood and you miss writing M, you do a typography, so you will end up writing that I'll draw 5 liters of blood from the patient. So you have to be very careful with the units which you will be writing, and the concentration and the incubation time, everything. Machine specification is also very important. So you have to write, for example, if you are using a real-time PCR machine, so you have to write the model number, manufacturer, and the country of origin. So all these three will give you your protocol or your thesis more authentic nature. So what people do is they take photograph of machines and put, so that is actually not necessary. If you just mention the name, model, and the make, so that gives you more credibility to your writing. Then who will do the assessment and what tools? Like for example, suppose you want to see the expression of P53 in the tumor cells or in the cancer, say ovarian tumor. Then you have to write that P53 expression will be seen by immunohistochemistry in pathology. So in the department of pathology, so the reader will know what was done where. So that thing has also to be clarified. Then any forms you are using, like a questionnaire or a case report form, so that also you have to include in your material and method. So you have to actually attach that as either as an annexure or in the material and method section itself. And if you are doing some intervention, then obviously at what frequencies. For example, if you are doing the effect of vitamin D supplementation on bone density, you have to say how every day you will be giving vitamin D, or once a week 60,000 international unit, and for how long. So that has to be clearly mentioned. Then suppose if you are doing procedure, some ultrasound, like in just Dr. Sandhya in a previous talk, she said about that sphincter study which she did, and transperineal ultrasound. So how after delivery, at what duration you will do that ultrasound. So those things you have to mention very clearly. Now, if you are doing a drug trial, then what is the dose, which formulation, from where you will procure the drug, how will you make a placebo which is looking similar to that capsule which you are giving the drug. And so everything, even the purity and all the manufacturers certificate should also be attached if you are doing a drug trial. And then in which cases you will withdraw, like you will withdraw the trial. For example, you must have seen the fiasco about the hydroxychloroquine trial which was going on for the the coronavirus treatment or prophylaxis. So they were once withdrawn, and then again they started, and then again it was stopped. So those criteria should be actually clarified, that if this, after so many patients I see there is no effect, then I will withdraw the study, or if this side effects emerge, then I will stop the drug. So all these rules of withdrawal must be predefined, and how will you handle those who violate, those who don't take the drug, dropouts, and how will you test whether the patient is taking drugs? Either you do a DOTS, like direct observed therapy, or you do an HPLC to evaluate the drug levels in the patients whom you are giving that trial. So you have to make sure, you just can't say that I have given this drug, now I don't find any difference, because that may be because the patient didn't take the drug. So that will not be a valid argument. You have to have some method of check to ensure that the patient has taken the drug. Then the most important part is the outcome measures. So you will have a primary outcome measures. So there is a notion which goes on in UCMS. I don't know why, that people think that there should be only one primary objective or one primary outcome measure. It is not necessary. You can have two primary objectives and two primary outcome measures also. So you have to mention how that outcome will be measured. For example, if your outcome measure is the effect of drug on blood pressure, so your primary outcome measure is the change in the blood pressure. So how will you measure, how frequently will you measure, and what will be the instrument you will use to measure the blood pressure? So all these things has to be mentioned in the methodology. And then what secondary outcome measures may come out also, that also you can do. So let us now see. It is always a good practice if at the end of the methodology section you make a flow chart, which just by looking at it you can you get a clear idea like what you are doing. And this can also be your reference guide also when you are taking samples. So for example, now this study, what I have just this is an hypothetical study which I have designed, because this enzyme lipoprotein lipase is involved in uh, breaking down the triglycerides into fatty acids, and this is activated by the apolipoprotein C2. Now I want to see why the free fatty acids are high in diabetes, and whether it has a role in the lipid profile. So I want to see the expression of lipoprotein lipase and the level of this protein. This is a protein, so I will do an ELISA for it, and what happens to the total cholesterol, LDL cholesterol, VLDL cholesterol. So this is how I'll go about. So I'll define cases and controls in diabetes, and those not suffering from diabetes, I'll write the inclusion and exclusion criteria. Then how much blood I'll take. So I'll take 3 ml blood in EDTA. It will be whole blood. And then for serum, I will take 5 ml blood in plain vial. Then this I will aliquot into 1 ml and store it in 20-degree for RNA isolation. Then I'll check expression of, I'll use this RNA to check the expression of lipoprotein lipase by real-time PCR and so on. So you give a brief outline of what you want to do, and also you mention what statistical analysis you will do. A statistical analysis, usually we play safe and we write we will do student t-test and Pearson correlation. But you have to clearly mention which parameters you want to compare, and it is not, so this deciding it beforehand gives your thesis more direction. So it is not that you end up कि कुछ भी नहीं आ रहा है, तो over analysis is a bad thing to do on a thesis. So what students usually do is you do not get कुछ भी significant नहीं आ रहा है, या कोई difference ही नहीं आ रहा है study के इतना मेहनत के, और इसके साथ इस ग्रुप को देखो, इस ग्रुप के साथ इस ग्रुप को देखो कि कुछ भी आ जाए कहीं से significant, and then you write that. So that should be avoided. There is nothing called good result or bad result. Whatever you are getting, whether if there is no difference also, that is also a result, and you can say that your hypothesis is not true, or your null hypothesis is not true and your alternate hypothesis is true. So that is also a result. So do not shy away from reporting negative results. So you have to be very clear and write this parameter and this parameter I'll compare by using students unfair test or this. So you'll have a statistical session separately, I think. So again, this is a repetition. You will have to mention the how you will do the data handling. So it is always better to write that all the data will be entered in a Microsoft Excel. I'll use Microsoft Excel, and I'll be using SPSS version 17, 18, 20, whatever is currently going on for statistical analysis. And then here again, you can, if you have not mentioned the reason for the sample size selected, you can use it here. And what is the power of the study and what level of significance is the p value, whether it's less than, usually we consider less than 0.05 p value to be statistically significant. So that is what is commonly used. Things to avoid: you should not start discussing things. Of method is, you have described, I will use this method. Suppose you are saying that I will use say transvaginal ultrasound instead of abdominal ultrasound for measuring the sphincter tear. So now you do not say why this is better, because this has more sensitivity, specificity. You don't have to do those discussions here. Here you have to just mention I will do this. Is why you have chosen that you can go you can discuss in the discussion part. Then what people do to generate more data, they will do number of ways to measure the same thing. Like I have seen people doing protein expression by Western blot also, or by immunohistochemistry both. So that doesn't add any value to your thesis. So just you are wasting time and resources by measuring the same thing by two different methods. So you should avoid that. And you should not use slang or jargon in the which we commonly use in the OPD or clinics, some short term or something which is an abbreviation of a terminology, which others who is reading a particular topic for the first time may not be able to just comprehend. So you have to be clear about what abbreviations you're using, and always mention the full form of the abbreviation the first time you're using. Do not use the alternate abbreviations at different places. So if you have abbreviated with some in some way, you have to maintain it throughout your thesis, not only in the material method section but throughout your thesis. Then of course, what happens while writing material and method is you tend to copy it from someone else. So while copying it from someone else, like I showed you the part of a thesis, and so you are copying it from a thesis and you are giving a protocol. So you'll find that at some places you have written was to be, was will be, or then was be ho gaya wahan pe. So this kind of tense errors becomes very evident, makes it very evident that you have copied it from someone. So you have to doubly check that you are using the proper tense and grammatically you are correct. And then do not use approximate values like around 10 ml of blood will be taken. No, you have to specifically mention that I will draw 10 ml of blood. उसमें कितना सब पूरा अकाउंट होना चाहिए कि 10 ml blood ऐसे ही ले लिया और फिर मैं देखूंगा कि किससे क्या करना है, वैसा नहीं. You have to be clear, like if I am taking 10 ml of blood, उसका हर एक ml का अकाउंट होना चाहिए कि ये इसके लिए चाहिए, ये इसके लिए चाहिए, as I showed you on the close. So this is a checklist. I hope we will be sharing the PowerPoint, I hope, Dr. Ami, with them. So you can use this checklist to see that you have mentioned all these points in your methodology section before you submit them. Thank you. I'll be happy to answer any questions if there is time.
I think we are well in time, so I think because it's already late in the evening, there are no questions I see, but the participants are requested to please type your questions. We are simultaneously responding. And thank you, Dr. Adarshi. That was a very good presentation on the material and methods, and the statistics and part will be dealt with, the sample size will be dealt by Dr. Arun Sharma. And now I would like to invite Dr. Ashish Goel. He would be talking about choosing an appropriate study design. So over to you, Dr. Ashish.
Good evening, friends. So I noticed that we have a slight attrition from yesterday's figures, and we have a little less number of attendees than what we were having yesterday. And I would be talking today on how to choose the appropriate study design. Here on the title slide, you would be able to see the different kind of research designs that we have. But before I'm going to begin my presentation, here on it's about 6:25. We shall finish before 7, and that will be my attempt. Let's have a 1 minute or a 2 minute break so that those who have been sitting here since 5 o'clock in the evening will get a chance to stretch their legs and close their eyes and take a drink of water. So here I am giving you a 2 minute break, after which we will come back and I will resume my presentation from here on. So I do hope that at the end of a 2 minute break, some of you are still here. I would like to take up a few questions that were asked in the previous session, and we can address them before we proceed. Tanya asked, exclusion criteria should be discrete. Now, I'm not sure what you intend to ask by that, Tanya, but I'm going to unmute you and allow you to ask that question in person if I can find you. Maybe you've already left. Yes, no, you're right here. So I've unmuted you, Tanya, and you may proceed and go ahead and clarify your question. In the meantime, I will take up the question by Niharika. Niharika, you have asked, do we have to mention references at each method step, or has it to be concluded in the end as how we see in articles and books? So the references are generally cited in a Vancouver format, or you do not put the references at the end of each section or at the end of each step. You do number them in line with the text, but the references or the bibliography appears at the end of your protocol or at the end of your thesis. I hope that clarifies the question. If not, please raise your hand and I will address that once again. Tanya, if you are ready, you can ask your question now.
Hello.
Yes, Tanya, go ahead.
So in the last session, we were told that exclusion criteria, about the exclusion criteria. So sir had mentioned that it should not be something other than the, means I don't get the concept of what he meant to say, what he meant by
Okay.
it should not
So I get your
include
question.
the.
What you are trying to ask is, अगर हमने 100 लोगों को include किया है अपनी thesis में या अपनी research study में, तो exclusion criteria are the criteria from within those who have been included. अगर सर ने जैसे कहा कि हम अगर 20 से 30 साल की females को लेंगे अपनी study के अंदर, तो आप एक्सक्लूजन क्राइटेरिया में ये नहीं लिख सकते कि हम 20 साल से कम की फीमेल्स को नहीं लेंगे। जो इंक्लूड ही नहीं हुए उसको आप एक्सक्लूड कैसे करोगी? सो इंक्लूजन में जो अंदर आ गए हैं उनके बाद उसमें क्या क्राइटेरिया लगाओगे जो एक्सक्लूड करने पड़ेंगे? Those who have been including after fulfilling your inclusion criteria, are there any conditions in which you would exclude them? Does that answer your question? Does that satisfy? If not, I will take it up again. Batao.
So means we are taking a broad sample and then we are sorting the criteria according to our specifications.
करेक्ट, आपने एक ग्रुप को इंक्लूड कर लिया और उस ग्रुप को इंक्लूड करने के बाद क्या उसमें से कुछ ऐसे मरीज हैं जिनको आप एक्सक्लूड करोगे किसी भी कारण की वजह से? There might be some patients who have exhausted or who have fulfilled all your inclusion criteria, yet you have not included them in your thesis. ऐसे कुछ मरीज हैं क्या? उनको एक्सक्लूड करने का क्या कारण था? जो इंक्लूड कर लिए हैं उनके अंदर से क्या कुछ लोगों को बाहर निकालना पड़ा या बाहर निकालोगे? What are those exclusion criteria? Does that make it better?
Yes, sir. Thank you.
Right. Thank you, Tanya. And you can unmute yourself. I mean, you can mute yourself again. So fair enough. With that, I will proceed with my presentation per se. And here I'm going to launch a poll. And I would like to ask you on your screens coming up now as to, have you done your MBBS from UCMS? It's just yes and no, simple question. Go ahead. And I just want to see how many of the group is students from UCMS. Fair enough. So I get an idea that about 10% of the students are from UCMS. Another poll coming on your screen now is, are you a PG in medicine? So that I would know how many medicine PGs are actually attending this session. And the percentage can definitely not be more than about 10 to 12%. Let's see if all of them are here actually. Yes, quite a few of them. So I would be addressing individuals in that fashion then. So at the end of this session, you would be able to enumerate the different study designs. You would be able to differentiate between observational and experimental studies. You would be able to differentiate between cohort and case control studies. And you would be able to choose an appropriate design for a research question. And you would be able to define terms like randomization, blinding, and matching in a little more detail. So let's see what is the fundamental principle for biomedical research. The basis of all our research is that the disease is not randomly distributed in the population. It is clustered, it is in specific groups, and it depends upon certain lifestyles, factors, or exposure variables which will determine कि किसको बीमारी होगी और किसको नहीं होगी. Research always uses a systematic approach to study this distribution. A limitation of our research is that we cannot predict human behavior. Why do we need to do select a study design? Well, you need to define why you want to do your research, and that will help you understand what kind of a design it is. You might want to quantify something, such as the prevalence of disease, or you might want to compare two things, such as which intervention is better, A or B. You might want to predict something, किसको COVID होगा या किसकी COVID से death होगी या whatever X and Y. You might be wanting to predict something. You might want to study the association between A and B. Is A related to B? You would want to explore etiology. क्या इसके होने से वो होता है? Does this exposure cause an outcome to occur? So broadly, these are the different reasons why you might be wanting to do research, and let's proceed on from here. And without getting into any other paraphernalia, this would be one of my most important slides in my presentation. And if you are not with me, I would like to have your undivided attention for the next 3 minutes in which we will cover this slide. If you get this slide, you don't need to listen to anything else that I have to say after this. So the first thing that we need to understand, आपको जब अपना methods लिखना पड़ेगा, जैसा डॉक्टर राजर्षि ने पिछले सेशन में बताया था, पहली line you would have to write is what is the study design? What is the design of the study that you are conducting? So first thing which you should be able to easily identify, is this an observational study or is it an experimental study? अगर आपने स्टडी में या मरीजों के साथ ट्रीटमेंट में कुछ भी इंटरफियर नहीं किया है, if intervention is not your plan, then it is an observational study. If there is an intervention involved, then it is an experimental study. So we get the two. Is it an observational study or an interventional study? I hope the fact in this initial stage is clear and you are still with me. If so, if it's an interventional study, let's take that up first because that's easy to understand. The next question to ask is the allocation random? यानी कि एक ग्रुप ऐसा है जिसको आपने ट्रीटमेंट या इंटरवेंशन दिया और दूसरा ग्रुप ऐसा है जिसको आपने ट्रीटमेंट या इंटरवेंशन नहीं दिया, तो क्या मरीज के एक ग्रुप में होने की संभावना दूसरे ग्रुप में होने की संभावना से बराबर है या अलग अलग है? बराबर होने का तात्पर्य is what we say is the allocation random. Is there something someone wants to say? Amir, are you trying to say something? Slides aren't changing, Vinita. Oh, slides not visible. Let me see. If I have been sharing my screen, I am the presenter. So the slides should be visible and I'm sharing my screen with you. Let me try and change that again. And so the previous slides were visible before this.
I am still seeing the slide.
आपकी आवाज clear नहीं आ रही आमिर, so I can't understand what you are saying.
Only the first slide is visible. Only the first.
None of the other slides is visible. Okay,
it's
so
not
I have
even
been
in slideshow. It's not even in slideshow.
Okay, so probably I'm speaking to myself for the last so many minutes. Let me try and get this sorted out.
Now something has changed.
Yes, obviously.
Now it has come to the 5th slide. Yeah.
Are you able to see the slides now?
Yes, it has changed to 5th.
Okay, so we are looking at a flow chart. It's not on slideshow. Okay. Let me try and figure it out and get out. So Rajarshi, you have signed in from the UCMS MEU account and Amir is also from the UCMS MEU account. So that should not cause this problem. So I'm trying to sign out from one of the accounts and hopefully this should get sorted out. And let me not share my screen and then reshare my screen with you. So my screen should not be visible now and I'm trying to show my screen now. Does it make it better? Again, the 5th slide should be visible now. But in slide presentation mode?
5th slide.
Is it in presentation mode?
No.
It is white now, it is coming.
Now it is.
Okay. So what I was doing was this. You should be clear by this time if it's an observational study. अगर आपने intervene किया है या नहीं किया है. If you are interfering in the treatment, it becomes an experimental design. If you have not interfered in the treatment, it becomes an observational study. Supposing you have decided कि आप allocation randomly करोगे,
Ashish,
so it
I
becomes...
can't see the I can't
It
see
is
the
white.
slide. I can't see anything. It's a white screen.
It's a white screen now.
Okay, so it probably doesn't take animation. So let me do it without the animations, and I will then do it without the screen. Let's say
Slideshow. Yeah.
slideshow, or I could
Don't
do
do
it
it.
in this.
Don't put it on slideshow. When you are putting it on slideshow, it's becoming white. So just coming out of it, then it is visible.
Okay. So what is here is without the slideshow. What I was trying to show was, is the allocation random? If it's not random, it becomes a non-randomized non-randomized trial. If it is random, it becomes a randomized trial. Coming back to an observational study design, the first question to answer is there a comparison group? Supposing there is no comparison group, this is where we are. If there is no comparison group, then it becomes a descriptive study. And an example of a descriptive study would be a survey. However, if its comparison group is present, then it becomes an analytical study. And here we would be doing a comparison. But what is the kind of comparison group that we have is probably determining what next we do, whether it's a disease versus non-disease or risk factor versus no risk factor. So if we are studying individuals who are diseased and comparing them with those who are non-diseased, that becomes a case control study. And here we are starting from the diseased individuals and evaluating or the level of exposure within them. Okay. If we are starting with individuals who are exposed and we are classifying them into groups by exposure, then it becomes a cohort study, and we follow them up and see how many of them get diseased and how many of them don't get diseased. So if you are studying the disease and exposure at the same time, it becomes a cross-sectional study. I do understand that this did not proceed in the way that I had planned it to proceed with certain animations in the slide. But we do with the modifications and improvisations. So I'll take up randomized controlled trials to begin with. So randomized controlled trials basically are indicating random allocation. Is there a random allocation? So we include a sample of patients with the condition who meet the inclusion criteria, and we allocate them randomly to a treatment or to no treatment. They receive either the experimental treatment or a standard of care. The experimental and the control groups are then prospectively followed over time, and we see which one gets the outcome and which one doesn't get the outcome. There's a term called blinding. Blinding, basically the patient does not know what treatment he's getting. क्या उसको treatment मिल रहा है या नहीं मिल रहा है? Was he getting an experimental drug or a control drug? He does not know. If that is the case, it becomes a single blind study. If he knows what he's getting, that becomes an open label trial. But if he doesn't know, this is single blind. अगर डॉक्टर को भी नहीं पता कि उसको क्या मिल रहा है, then it becomes a double blind, and the evaluator also did not know who was getting what, and the person who is analyzing the data also doesn't know. It becomes a triple blind study. It's basically blinding. So on your screen, you might be able to see one figure which asks, or where is a doctor who was talking to a patient and tells him that you are pregnant. Now this is a judgment, but I'm launching another poll on your screen, and I want you to answer this poll. This judgment made by this particular doctor, what is this kind of judgment? Is it a true positive Is it a true negative? Is it a false positive? Or is it a false negative? I'll leave the poll open and then we will take and see the answers to this poll. So if you want to answer, we have another 5 seconds for you to answer, and then we'll close the poll. Right. So I'm sharing the results with you. So almost 81% of you have correctly identified this as a false positive. Obviously, if you see this, it's a male patient and he cannot be pregnant. So it's false. The judgment is false. And it's a positive judgment that he's pregnant. So it's a false positive judgment. But if you look at this, then this error, what is being made, is the type 1 error, in which let me try and give you a slide presentation again. And if somebody could volunteer and tell me, are you able to see the slide now after I have put it on slide presentation mode, and if it has sorted out? If someone with me still, is the slide visible now, or is it
Stop
again?
sharing the poll results, Ashish.
Right now we are seeing poll result. Yes.
It's still showing the poll results. Okay.
Shall I hide?
Okay, I've hidden the results now.
No, it's still showing that. Yeah, now it's
still
without the slideshow.
It's without the slideshow. Does it go on to slideshow now?
Yes. Yes, slideshow is there.
So you can see the slideshow, and
yes.
We have a
Judgment
type
alpha,
1 error, which is false positive.
No, alpha
So
beta power that you are pregnant वाला picture जो है ना?
Yes.
लेकिन मेरे यहाँ पे
So that is
नहीं आ रहा.
I'm seeing slide 9.
No, is it in
But not
slideshow
slideshow.
mode?
No slideshow.
Oh, fair enough. So I can't move without a slideshow. So let me take away whatever was hidden on this. So we have another picture in which there is a type 2 error, in which is a false negative. You can see obviously there is a woman who's very much pregnant, and the lady doctor in that frame is telling her that you are not pregnant. This is a false negative kind of an error. I'm trying to show this slide just intuitively. From next time onwards, you would not make a mistake between a false positive and a false negative error, and you would be able to intuitively surmise what we are talking about. Alpha is nothing but the probability that we will make a type 1 error, and beta is just the probability that we will make a type 2 error, in which we would tell a pregnant woman that she's not pregnant. If you internalize this particular slide, you would easily be able to identify a type 1 error, which is false positive, and a type 2 error, which is a false negative, by recollecting this picture whenever you are in doubt. So again, I cannot do animations on this because the slideshow is not functional in this today's seminar. But what I wanted to do was let's drop it. There's no point in taking this up without a slideshow. So we just will have a drab and dull presentation. That's okay. Measure of effect is generally what you would all be struggling with when you are doing your studies. If it's a cohort or a case control study, in which you would be trying to figure out what's the relative risk or what's the odds ratio. So relative risk is the ratio of probabilities of contracting the disease if you are exposed, whereas odds ratio is the ratio of odds of contracting the disease given the exposure. So if the relative risk or the odds ratio is equal to 1, then there is no effect of the exposure. That indicates the graph on the right side, or the figure on the right, indicates what is the ratio and what is a rate and what is a proportion. So I have shared all these slides with you already in the handouts which are associated with the GoToWebinar, and you could see these slides from there, and you could refer to this if you are struggling between what is a rate, what is a proportion, and what is a ratio. I would go on to a cohort study.
Ashish,
So a cohort study is based.
Ashish, can
yes.
Can I share the slides if you want the animation to work, or you can try that?
If you have the slides, you can go ahead, or I can attach the slides and send. You already have the slides are already there on the handouts, so they can. It's fine. I think without prolonging their misery, we will conclude this at some point of time. If they are interested, then the animations would work in the slides that they have. Basically, cohort studies are ones in which we have a group which we recruit for a study at a particular time, and they have the exposure. Some of them may have an exposure, some of them don't have an exposure, and we over time to see how many of them develop the disease. लोगों को exposure था, exposure था, से कितने लोगों, and we compare the rate in exposed versus the non-exposed groups, we would get what we determine as the relative risk, जो अभी हम पिछली study में बात slide में बात कर रहे थे, and we would know what is the measure of association in a cohort study. Again, this is a 2x2 table which will not work without animation. This is just a take on from one of the previous slides which we did not see, but in brief, if it's a study starting in 2020 and you follow it up till 2022, taking up a group of students who were studying for NEET, and if the exposure we want to determine in 2021, how many of them had a girlfriend or a boyfriend, and trying to determine if having a girlfriend or a boyfriend is associated with your ability to create a clear NEET or not, and we get the answer to that question in 22, then that would be a cohort study in which we have assembled our cohort in the year 2020, looked for exposure in 2021, and then the outcome of NEET clearance in 22, which would become a prospective cohort study. Supposing I wanted the result in 2020 itself, so I could assemble my cohort back in time. I might go to a coaching center and ask them for the details of all students who were studying for NEET in their coaching center in 2018, और मैं फिर देखूं कि उनके coaching center में 2018 से 19 के बीच में how many students had a girlfriend or a boyfriend, and then I see how many cleared NEET in 2020, and then this would become a retrospective or a historical cohort study. So again, remember that although study मैं 2020 में ही कर रहा हूँ, but I have put together my cohort in 2018 when the NEET clearance had not occurred, and then I start following them up. Although I'm in 2020, I follow them up from 2018. मैंने exposure पहले measure किया है और outcome बाद में measure किया है. Please remember this statement. मैंने exposure whether they had a girlfriend or a boyfriend 2018 में यानी कि पहले measure किया है, और उनका NEET clearance बाद में measure किया है. That becomes a cohort study. अगर मैं 2020 में ये study कर रहा होता और ये देख रहा होता कि कितने लोगों ने NEET clear किया है, और उसके बाद मैं वापस जाके ढूंढता कि उनका गर्लफ्रेंड या बॉयफ्रेंड था या नहीं था, then that would become a case control study, because मैं आउटकम के हिसाब से डिटरमिन कर रहा हूँ कि कौन किस ग्रुप में बैठ रहा है. Most of the cohort studies are similar to an RCT because they both compare exposed to non-exposed. In RCTs, exposure is same as intervention, whereas in a cohort study, an exposure is as good as a risk factor. However, the difference in between a cohort study and an RCT is the fact of randomization, and that is critical to interpretation. because agar randomization nahi hoga to we will always be in a doubt whether some factors predispose to exposure or not. When we are randomized, then we believe that because of the process of randomization, the risk factors are equally distributed between the two groups. Coming to case control study. Now again, I said the case control study is when you start with cases. That means the outcome has already occurred and the groups जो हम बांट रहे हैं, जो हम groups classify कर रहे हैं, that is on the basis of the outcome. कितने लोगों ने नीट क्लियर कर लिया है एक ग्रुप में, कितने लोगों ने नीट क्लियर नहीं किया है वो दूसरे ग्रुप में, और फिर हम देखते हैं कि उनमें से एक्सपोजर कितने लोगों को था और कितने लोगों को नहीं था. That becomes a case control study. You start with diseased versus non-diseased, and then we measure the exposure. So just remember, if you begin with the disease and classify individuals into diseased versus non-diseased or outcome ya non-outcome, then we say it's a case control study. But if we classify our groups according to those who are exposed or non-exposed and then measure how many get diseased, then it becomes a cohort study. So there are some potential biases in case control study. The most important one is a selection bias. जब हम incident और prevalent cases लेते हैं तो हम ये हमेशा सोचते रहते हैं कि shall we take the incident cases or the prevalent cases. Incident cases माने जिन लोगों को नया बीमारी अभी डिटेक्ट हो रहा है, या prevalent cases माने जिनको पहले से बीमारी चल रहा है. For example, if we are studying blood pressure or hypertension and we take cases जिनका अभी नया नया ताजा डिटेक्ट हुआ है versus we take prevalent cases जिनको 10 साल से hypertension है. So it depends upon what is the question we are trying to answer. But in general, if you are selecting an incident case, then it takes longer to complete your study, and your risk factors are prevalent in those. अगर हम prevalent cases लेते हैं, so then the risk factors that we are studying or getting are more related to survival than really to etiology. If supposing the cases die soon after their diagnosis, then the survivors may really not be truly representative of the condition that we are trying to study. The selection of controls is another important question that you would have to decide when you are designing your study, in which case you would have to choose between either non-hospitalized people versus hospitalized people. Non-hospitalized में हम generally neighborhood के controls लेते हैं. We might take a best friend control or a relative control, or a relative, उसका relation रिश्तेदार उसका would end up as a control. Hospital controls लेने में problem ये आती है generally that they are an ill-defined reference population, but at many times we do take hospitalized patients. एक problem जो हम controls के साथ देखते हैं, that is that when you recruit somebody as control, that itself may change the behavior or exposure of that person. There is something called as a misclassification bias. That means there is a limitation of recall. अगर आपने disease होने के बाद किसी से पूछा कि आपको अब COVID हो गया है, आपने PPE ठीक से पहना था या नहीं पहना था. Both the groups may not be able to remember कि मैंने उस दिन PPE ठीक से पहना था या नहीं पहना था. So they might say yes or no, and ultimately उन्होंने क्या किया था वो हमें पता नहीं, but misclassification bias हो जाएगा that you would classify exposed as non-exposed or non-exposed as exposed. The another kind of bias is a recall bias. So जिसको बीमारी हो गया, he has more tendency कि वो सोचता रहेगा मैंने क्या किया था कि मुझे ये बीमारी हो सकता है, मैंने ऐसी कौन सी चीज खाई थी जो मेरे पेट में दर्द हो गया. So those who get the outcome have a greater chance of recalling things. So they will clearly remember because they have thought over that for a long period of time and will be able to tell you much better about their exposure. जिनको बीमारी नहीं हुआ उनको याद नहीं रहेगा, ना वो ठीक से याद करने की कोशिश करेंगे, and what you will get is recall bias. Another thing that you will have to do while you are designing your studies in case control designs would be matching. Matching, आपको एक case मिलेगा उसके लिए आप कंट्रोल मैच करके लोगे। सो मैचिंग ग्रुप मैचिंग के तरीके से होती है when you have selected all your cases first and you have calculated the proportion of characteristics in these individuals and then you choose a control group keeping लगभग मोटे तौर पे ये चीजें बराबर रहें। There could be an individual matching, आपने एक केस लिया और उसके साथ आपने एक कंट्रोल मैच किया उसी एज का उसी सेक्स का, that's called matched pairs। मैचिंग का प्रॉब्लम ये है कि अगर आपने एक वेरिएबल के ऊपर मैच कर लिया है, आपने अगर एज और सेक्स मैच कर लिया है, तो आप ये कभी नहीं बता पाओगे कि एज और सेक्स का क्या प्रभाव है आउटकम के ऊपर। Once a variable has been matched, you will not be able to study that variable in the association with outcome. I do understand that we are already past 7 p.m. and in the last two slides, I'm going to conclude. This is a general 2x2 table, but it really doesn't make sense in the absence of the previous tables. But in a cohort study, this is how a 2x2 table would look like. In one column, you would have disease. In the other column, you would have non-diseased people. In one row, you would have exposed individuals. And in the other row, you would have non-exposed individuals. For a case control study, this same table would look a little different. Exposed और non-exposed की परिभाषा तो वैसी ही रहेगी, but cases और controls की परिभाषा बदल जाएगी. So in a cohort study, when you had disease versus non-disease, in a case control study, you would have cases and controls in the columns. And in a case control study, you would be calculating what is called the odds ratio, which is the odds of disease in exposed divided by odds of disease in non-exposed. I don't have anything else to say on this, but I have 3 polls if you want to take up 3 exercises, which will be quick and can be completed in 3 minutes. So the next poll for question would be, the question that is being studied is partying more than 3 times a month throughout the first year reduces the chance of passing PG in first attempt in UCMS. तो क्या वो लोग जो पहले साल में 3 बार से ज्यादा हर महीने में पार्टी करते हैं, do they have a better chance of passing post graduation exam than those who do not party? The poll is coming up on your screens now. The question is that partying more than 3 times in a month in first year, has it got a better chance of getting passed in the first attempt in post-graduation? To answer this question, what would be the study design that you could use? Would it be a case control study? Would it be a cohort study? Would it be a randomized control trial? Or would it be a cross-sectional study? Closing the poll in another 5 seconds, and then I will show you the answers to your poll. Cool. So poll closed now, and I'm sharing the results with you. So 73% people said cohort study, 21% said case control study, 4% said cross-sectional study, and 2% said randomized control trial. Well, to be honest and truthful, this question can be answered by all the 4 designs. If I say it can be answered by a randomized control trial, यानी कि हम लोगों को बोलेंगे, we'll divide them into 2 groups, 2020 batch को, we will divide them into 2 groups, and we will tell them that one group will party at least 3 times a month, and the other group will not party. And फिर जाके हम 2023 में देखेंगे कितने लोग डायरेक्टली पास हुए और कितने लोग नहीं पास हुए. But it can be done, yes, by a cohort design, it can be done by a case control design, it can be done by a cross-sectional design also. So next slide will have the next question. It's the same question with a slight modification. So please read the modification carefully. The question remains the same. Does partying more than 3 times a month throughout the first year reduces the chance of passing post-graduation in first attempt in UCMS? Now the condition added here is that I want to give this as a thesis to my PhD student who will be working on this particular topic for 5 years. 2020 बैच अभी आया है, 2023 में उनका रिजल्ट आ जाएगा. We will know the answer. And 2025 में मेरा PhD student अपना एग्जाम देगा when he will be having to answer this question. So this is the question coming up on your screens now. अब इस condition में, do you think what would be the best way to study this? Using a case control study, using a cohort study, using a randomized controlled trial, or using a cross-sectional study? So I'm leaving the poll open for another 10 seconds, after which I'm going to close the poll. And those who have not answered can take it up. Cool. So I show you the results. Yes, 73% have answered. A cohort would be the best way to look at this particular study design, because I can recruit people who have joined in 2020 and follow them up to see कि कितने लोग पार्टी कर रहे हैं हफ्ते में 3 बार या महीने में 3 बार, and then see कि कितने लोग end में जाकर पास हो गए हैं. Case control is not the right answer at this particular point of time, because I have 5 years in my hand, and so a cohort would be a better way to do it. RCT is not a good way to do it, because मैं force नहीं कर सकता किसी को कि आप 3 बार पार्टी करो या आप 4 बार पार्टी करो. So it has to be more of an observational design in which I do not interfere and I just see how many were partying and does partying has got any association with the outcome in the exams. Last question on this, same, but the condition has changed. इस बार मुझे आंसर 1 महीने के अंदर चाहिए. I want the answer in 1 month so that I can advise the 2020 batch students on how frequently they should party. So मुझे आप लोगों को बताना है कि पार्टी कितना करो, and so I need the answer in 1 month's time. So what is the best way to give advice to 2020 batch students कि partying से first time attempt में आप pass होते हो या नहीं होते हो? In this case, what would be the best way of doing this particular research study? And the poll is open now. And if you can answer this question, then I would say you have understood most of what we have talked about in the last 30 minutes. Cool. So the voting has ended in another 5 seconds. I will be closing the poll and sharing the results with you. Closing the poll now and sharing the results. Yes. So case control studies, as you have said, 60% of you, is the correct answer to try and find out what is the nature of association between partying and the outcome. So the easiest thing I could do is I could recruit 2017 batch के students who have already passed or not passed their first attempt, although 2017 वालों के साथ कोविड के चक्कर में सारे के सारे पास हो गए. But let's say एक batch previously अगर हम लें, we could easily ask them, divide them into 2 groups, those who have passed in first attempt and those who have not passed in first attempt, and try and ask them how many times they used to party in a month in the first year of their post-graduation, and try and associate with the outcome of clearing the PG in the first attempt. Cross-sectional design is possible in this case. Oh, probably somebody wanted to mute me. Okay, I agree to being muted. If you're still with me and if you want to ask questions, let me see if anyone has asked questions visible. Questions में तो visible और non-visible वाला issue ही चल रहा है. But if anyone has raised hands, no, I don't see anyone raised hands. But there are some people who have put up questions which I don't see here. But if you raise your hands, then I can bring you up for, I can unmute you. Yeah, so some hands have been raised. Akanksha Agarwal, I'm unmuting you now. And please go ahead and ask your question. Akanksha and Hemant, you have raised your hands. Please go ahead and ask if you have anything to say. Both of you I have unmuted. Akanksha, Hemant. And after that, Vivek Kumar. Yeah, Hemant, bolo.
Good evening. Sir, I want to ask, we will include consent in inclusion criteria or exclusion criteria?
Actually, consent is not included in neither the exclusion nor the inclusion criteria. It is a mandatory criteria. It is one ethical requirement कि आप उन्हीं लोगों को लोगे जिन्होंने consent दिया है. Obviously, जिन लोगों ने consent दिया ही नहीं है, उनको तो आपने लेना ही नहीं है. So वो ना inclusion criteria में आता है, ना exclusion criteria में आता है. But बहुत से लोग उसको inclusion criteria में लिखते हैं. Depends upon your guide. Otherwise, it is not to be written an inclusion criteria. वो आपके दायरे के बाहर है. वो तो inclusion उन्हीं को इंक्लूड कर सकते हो जिन्होंने कंसेंट दिया है. There is no debate or discussion on that.
Okay, sir. Thank you, sir.
So my bottom line, my take on that would be, it is not a part of inclusion, it is not a part of exclusion. है ही नहीं, वो ना inclusion ना exclusion. आपको लेना उन्हीं लोगों को है जिन्होंने consent दिया है. End of the story. किसी भी research के लिए. So if
Okay,
that
sir.
answers your question, you can
Okay,
mute
sir.
yourself. Akanksha.
So you said that risk factors in prevalent cases are related more to survival than etiology. And if they die soon after diagnosis, then it is not truly representative. I
Correct.
didn't understand
So you didn't
that part.
understand that part. Okay. Supposing एक ऐसी disease है, let's say COVID. अगर हम COVID को study कर रहे हैं, so we have found that most of the deaths, let's say, या let's take up कोई disease जिससे एक बार infection होता है, तो 2 दिन के अंदर मरीज मर जाता है, right? मैं उसका ये देखना चाहता हूँ कि कौन सी risk factors और कौन से variables से मुझे पता चलेगा कि disease severe है या mild है. Do you agree? Are you with me so far, Akanksha?
Yes.
So मैंने अगर इंसिडेंट केसेस लिए, यानी कि जिनको अभी ताजा इन्फेक्शन हुआ है और उनको स्टडी किया, तो उसमें से नाउ आई नो आज ही उनको इन्फेक्शन हुआ है और आज ही मैंने रिक्रूट कर लिया और 2 दिन के अंदर मरीज मर गया. So I am taking only incident cases. Are you with me?
Yes. Yes, sir.
So अगर इनको मैं स्टडी कर रहा हूँ तो मुझे पता चल जाएगा कि उनके अंदर क्या था और 2 दिन में कौन मर गए कौन नहीं मरे, उसके साथ मैं क्लासिफाई कर लूंगा. ठीक है.
Yes, sir.
सपोजिंग मैंने प्रिवेलेंट केसेस लिए, यानी कि जिनको 5 दिन से बीमारी थी उनको भी ले लिया, जिनको 7 दिन से बीमारी थी उनको भी ले लिया, जिनको 20 दिन से बीमारी है उनको भी ले लिया. पर
Yes,
जो
sir.
मरने वाले थे वो तो 2 दिन में मर चुके हैं.
Yes, sir.
सो मैंने जो इकट्ठे किए हैं वो 20-20 दिन की बीमारी वाले हैं और उनके अंदर मैं ढूंढ रहा हूँ सिवियरिटी क्राइटेरिया. तो जिनको सिवियरिटी था वो तो चले गए, तो मेरे जो ग्रुप है उसके अंदर तो सिवियरिटी है ही नहीं. So they are not representative of what I'm trying to study.
Yes, sir.
Does that make sense?
Yes, sir.
तो मैं अपने सवाल का जवाब ढूंढ ही नहीं पाऊंगा अगर ऐसे रिक्रूट करूंगा तो. So it all depends मैं क्या आंसर ढूंढने की कोशिश कर रहा हूँ.
Okay, sir. And sir, one more question.
I'm not convinced in your okay, but anyway, पूछो.
Sir, during matching, if we are trying to match more than one variable, and we are not able to do equal distribution of the variables in our cases and controls, then how will we divide the population into the cases and controls? I'm not
मुझे
able
सवाल
to
नहीं
put.
समझ में. केसेस एंड कंट्रोल. सपोज अच्छा चलो हमने ये तय किया, हम उसी एग्जांपल पे चले जाते हैं. व्हाट, गिव मी एन एग्जांपल. कुछ भी एग्जांपल बोलो जो तुम्हारे मन में आ रहा है.
For example, in smoking and lung cancer, if I'm trying to match, if I'm trying to remove the confounding factor of age, and male sex.
ठीक है, सो आपने एक ग्रुप लिया जिनको लंग कैंसर है, एक ग्रुप लिया जिनको लंग कैंसर नहीं है। इसमें आपने दो वेरिएबल के ऊपर मैच करना है। एक तो आपने कहा एज और मेल सेक्स। तो मैंने पहले अपने जो लंग कैंसर वाले केसेस थे उसमें एक आदमी को चूज किया, फिर उसी के सेक्स के हिसाब से मेल सेक्स का मैंने दूसरा मेल लिया उसी एज का। अगर ये 60 साल का था तो वो भी 60 साल का मैंने रिक्रूट किया जिसको लंग कैंसर नहीं है। ठीक है, फिर मैंने
Yes,
इस
sir.
आदमी को पूछा तुम स्मोक करते थे और उसको भी पूछा तुम स्मोक करते थे। सो आई गेट द एक्सपोजर, दैट इज हाउ आई डू द मैचिंग।
So what is the
Now what
difference
is the
between
question?
random? So actually I
Between
wanted to ask.
randomization. Randomization is when you are intervening and you are giving a intervention or a treatment जिसमें आप ये डिसाइड करते हो कि ये ट्रीटमेंट वाले ग्रुप में जाएगा या ये नॉन ट्रीटमेंट वाले ग्रुप में जाएगा। रैंडमाइजेशन वहां पर इट कम्स इनटू फोर्स। वहां पे आपके हाथ में ये पावर नहीं होती ये तय करने की कि ये इसको ट्रीटमेंट मिलेगा या इसको ट्रीटमेंट नहीं मिलेगा। आप डाइस फेंकते हो या रैंडम लिस्ट में से उठाते हो या पर्ची उठाते हो ये तय करने के लिए इसको ट्रीटमेंट मिलेगा या नहीं मिलेगा। दैट इज रैंडमाइजेशन। और हियर वी आर टॉकिंग ऑफ मैचिंग। यहाँ तो कैंसर ऑलरेडी हो गया है उसको, हम ढूंढ रहे हैं स्मोकिंग के साथ में मैचिंग बाय एज एंड सेक्स। सो अगर एज एंड सेक्स के साथ मैच कर दिया तो आप कभी ये नहीं बता पाओगे कि क्या एज या सेक्स का कोई फर्क पड़ता है कैंसर के होने पर।
So my question is, like, if I'm trying to distribute age equally, and then the sex part is getting unequally distributed, and vice versa. Like, if I'm trying to distribute males and females equally, and then the age part is not being equally distributed.
ओके, सो आपने मैचिंग एक पैरामीटर के ऊपर किया है या दोनों पैरामीटर के ऊपर किया है?
सर दोनों पे करनी है because both of them can be
अगर आप दोनों
confounding
पे
factors.
मैचिंग कर रही हो तो फिर अनइक्वल डिस्ट्रीब्यूशन हो ही नहीं सकता। आपने अगर 60 साल का आदमी यहाँ लिया है तो 60 साल का आदमी वहां लिया है, 62 साल की औरत यहाँ ली है तो 62 साल की औरत यहाँ भी ली है, तो अनइक्वल डिस्ट्रीब्यूशन हो ही नहीं सकता क्योंकि आपने एग्जैक्टली एज और सेक्स मैच किया है दोनों ग्रुप्स में। इट इज नॉट पॉसिबल कि अलग अलग हो जाए। अगर आपने केवल एज मैच किया है तो हाँ सेक्स बिगड़ सकता है, but then sex was not matched and then you can study sex. It doesn't matter कि वो बिगड़ रहा है, but आपने मैचिंग अगर दोनों तथ्यों पर दोनों पैरामीटर्स के ऊपर करी है तो पॉसिबल ही नहीं है कि दोनों ग्रुप में बिगड़ जाएंगे। आपने तो छांट के लिया है।
Okay.
Yes, Amir. Yeah, go ahead.
What she
Amir,
is
Amir.
saying, I'm Rajarshi.
Yeah, Raja. Yeah.
So what she is saying is that she has recruited and now she is trying to match. So that is not the case. What you do, it. The matching is done at the time of recruitment. What you are talking about, you have already recruited and now trying to match the sex and age, and then if you are matching one, the other gets spoiled. So that doesn't work. You have to match it while you are recruiting the cases and control or the cohort.
Yeah, thank
In
you.
that
Thank
case,
you,
there
Raja,
is
for
no
taking that
chance
up.
of
Absolutely. Correct. Absolutely.
there is no chance
correct.
of getting spoiled. The situation you are talking about is you have already recruited so many cases, so many controls, and then prospectively or you are trying to match them. So that doesn't work. That
वो
is
नहीं
not how
करना
you
है,
are supposed to match.
you should not do it. Your matching is done at the time of recruitment. आज एक केस रिक्रूट किया, आज ही एक कंट्रोल रिक्रूट करो और मैच करो।
Okay, sir.
Does that solve the problem, Akansha?
Yes, sir. Thank you.
Right, Vivek, your go. And then उसके बाद we have Nonita who has written a question. And Vivek, your
Very good evening, sir.
Yep, hi.
Very good evening, sir. First of all, thank you so much for the nice presentation, and same for Elsie sir and Sandhya ma'am. It was really nice and very insightful.
मत मारो, सवाल पूछो।
So that is a general statement and imperative. So the question is, which I faced is, out of the two main observational and analytical studies, being the case cohort study and the cross-sectional, for most of the times they advise that better go with the cross-sectional study for your observational study during the MD thesis. So I just wanted to clarify, is there any minimum time frame for a cohort study to be validated if we do the same study as a cohort study rather than cross-sectional?
Depends upon your question. अगर आप देखना चाह रहे हो कि क्या ट्यूबरक्लोसिस की दवा खाने से मरीज की मृत्यु होती है या नहीं होती है, सो आपकी जो दवा है वो चलनी है 8 महीने या 9 महीने या 6 महीने, डिपेंडिंग अपॉन विच प्रोटोकॉल ही गेट्स, और आपने स्टडी
Right, sir.
3 महीने में खत्म कर दी,
Right,
right?
sir.
Your follow-up is only for 3 months, whereas the treatment was about 6 months, so it is an invalid study. However, it depends upon what question you are asking. अगर आप कहते हो कि एक्सीडेंट होने के बाद क्या डेथ हो जाती है 1 हफ्ते के अंदर, that's a very valid study. आपका कोहॉर्ट है, आपने सबको जिनका एक्सीडेंट हुआ उन सबको इंक्लूड कर लिया, फॉलो किया, and you are able to answer that question. So it all depends upon your research question.
Okay, sir. Got the point. Thank you so much.
So Nonita, you have asked one question. Why don't you ask it aloud so that everybody can hear it? जिसको मालूम नहीं है. Can't find Nonita. Let me try and arrange them. Yes, Nonita, I have unmuted you now and you can ask your question. I will read the question that you had written in this. What about the different types of cohort study? Now, I would definitely want to take up what different types of cohort study, whether you're talking of a nested case control study or a case cohort study. And I did make presentation slides for that. In the handouts, they are there and you can see. But it was too long a session already. 20 minute overshoot kar chuke hain, and Amir must be glaring at what I'm doing. But that would be a more advanced topic. And if you have reached that stage, then we would definitely have a good time talking to each other. So Nonita, I'm not taking that question in this particular session. There's another question by Hemant Soni. Is the intervention need to be therapeutic only? Definitely not. It can be any intervention that you do. It does not need to be therapeutic. But largely, yes, जब हम RCT करते हैं, so you prefer trying to do an intervention which is therapeutic. Nonita, you wanted to say something? You turned on your mic and then switched it off. If not, I will hand over to Amir and close the session. Rajarshi or Amir?
Thank you, Dr. Ashish. And it's a very good presentation. And thank you, Dr. Rajarshi, for timely intervening when the slides were not visible. At that time, exactly, my internet also went off and audio video got disconnected. So thanks for supporting. So I think we come to an end of today's presentation. Tomorrow we will be having 3 presentations. I would just like to give you a disclaimer, and that is what you will be actually learning your thesis writing, protocol writing, mainly from your guide and your co-guides. They will be actually dealing with the specific topics that you will be working on in future. What we are doing here is setting giving you some idea about what it is going to look like, what are the components that you have to go through when you are writing your thesis protocol. Our sessions should not be considered as a replacement for what you learn from your guide and co-guide. There might be differences. There might be differences in understanding a particular topic, as we are telling here, and as you will be discussing with your guides and co-guides. Please follow your the word of guide will be final in that case, because it is contextual, and what topic you are working on may change the meaning of certain things and the way it has to be done and looked at. So please work very closely with your supervisors and co-supervisors. That is the only thing I wanted to add today. So thank you everyone. And Dr. Ashish, can we share the presentation? The slide handout I could not see today. Yesterday it was visible, but today it was not visible. I think I downloaded it yesterday. It must be somewhere in my computer.
Yes, I also
Yeah,
could not
definitely.
find the handouts.
Okay, definitely you could
Okay.
share the handout. I have no problem. But just tell me, can you
Thank
see
you.
my screen now? And can it is it visible
Yes,
in
yes, the screen is visible.
and it is visible in slide presentation mode, right?
Yes,
With
Right.
all
yes.
the animation.
The animations are also visible.
So it was
Okay. So bye for now, everyone. We will do we will continue experimenting. We are all learning, so we apologize for anything, and students are also learning. So thank you, everyone. Thank you, Ashish. Thank you, Rajarshi. Bye bye for now. We'll meet you again all
bye.
tomorrow.
Bye, bye, bye.
Yeah, thank you.